Mhm.
Hi, this is Dr. Marcy with Agility Physical Therapy, and today I want to talk to you a little bit about pain and how that happens. So the posters that we're using are from the International Spine and Pain Institute, and their research on what happens with your brain, your pain receptors, and the tissues as things go through the system that can cause a pain response. The first thing that's important to know is that pain is an emotional response to a physical trigger, and everyone's emotional responses are defined by something different. So that can be your stress level, your mood, hormone levels, anything that can affect your daily balance in your life. So if we look at the first poster, it's on the brain's pain meeting. Basically, in your brain, there's a map of all your body parts, and in those maps of body parts, there's also the little areas for pain receptors. Those pain receptors can be triggered, again, by a lot of different things. It could be that you stub your toe, and that creates a pretty big response. It could be that you step on something, or someone runs into you, or that you are just in general not having great posture, and over time that not great posture leads to increased stress on the tissues in the back of the neck, in the head, and in the chest. And you end up with increased stress on those tissues, and that starts to create a nociceptive or painful trigger to the nerve, and then it tells the brain, hey, I don't want to keep doing this, can you help me out here? And that's when you get a pain response. In people with chronic pain or fibromyalgia or chronic fatigue, something is constantly stimulating that level of nerve stimulation. So in most people, they might have a level where they're facilitated or activated down here. And so it takes a lot of time for them to get over that signal that sends to the brain the message that says, I'm in pain, stop. For somebody with one of those chronic conditions, they might have their base level right here. So the trigger for them is a lot smaller. It could be something as simple as you accidentally bumping into them getting off the elevator. And that triggers a complete pain reaction for them that seems to us unreasonable, but is actually very real to them because they don't operate down here, they're operating up here. It would be the same for a child who is autistic. They have a nervous system that's operating, instead of baseline here, here. So that little change in their schedule, or that little change in something that happens in the classroom, or where their chair is situated, or someone sitting in their chair, causes, instead of this much, and they get a little bit upset before they hit their boundary, they just hit that boundary right away and go over it and have an inappropriate response. The same thing happens with pain. The tissues that can be affected, it's very interesting to look at imaging studies, because when we look at imaging studies there was a research study done of about 5,000 hospital employees. When they did the imaging, they also had the people fill out questionnaires, and those questionnaires were related to pain and fear avoidance of movement. When they looked at the imaging compared to the questionnaires, about 80% of the people who didn't report any pain or any fear of movement showed up with imaging that had some kind of disadvantage or injury on it. That means that they could be having pain, but they're not reporting it as pain. So why was one person's imaging okay, but they report pain, and one person's not? Well, if you look back at this second poster, that's why their nervous system is already overstimulated and takes a lot smaller trigger. So one tiny little movement could set them off versus that person that has no real signs of pain, but they have an injury to a disc, or they have a little bit of arthritis or something like that. That can happen in the shoulder, it can happen in the neck, it can happen in the back, hip, knee, foot, ankle. It can even be in muscle tissue, where maybe you've kind of rolled your ankle but not fallen down, and you stress the muscles on the outside of your leg, and those muscles get a little bit irritated in some people, but in some people that makes them think, maybe I broke something, or maybe I should not be walking on this, or maybe I need to go get a pair of crutches, because their nervous system is just hyperactive. The pain cycle, usually there's an injury, it's perceived by the brain. All of these things, your beliefs, your job, fears, the things that you know or the things that you think you know, the treatments that you've had in the past, stresses at family, whether or not you have good support with your family, and then explanations that are given to you all go into what your brain and how your brain perceives. And then there's chemicals that are released, and they can all control things like appetite, mood swings, memory, depression, sleep, concentration. More chemicals get released, and you get things like soreness, tiredness, sensitivity, and deconditioning, and then it goes back into that whole injury cycle. So if we can find a way to decrease fears, decrease stresses, change what you think you know as the only treatment for that injury, and give better explanations, we might be able to change this cascade and help you reduce your pain levels overall. I hope this helps explain why some people have what they call chronic pain, or an increased sensitivity, or have more pain than the average person, and what you can do to maybe help that person in the future. Thanks, and have a great day.